Also at the state capitol, ambulance providers from here in our region and across New York are warning lawmakers and the governor that the current system involving Medicaid isn't working. That's because every time a Medicaid patient is transported by ambulance, the reimbursement from the state doesn't cover the cost. It's not even close. As a result, there are far fewer people working in EMS. These are the latest numbers that we have now from the state health department, showing a near 18% reduction in the workforce over a 3-year period ending in 2022, and it's likely gotten worse since then. Ambulance providers say this is just not sustainable and that the Medicaid reimbursement must go up. Bryan Brauner joins me live here tonight. He is CEO of Twin City Ambulance based in Amherst, and among those sounding the alarm here with the state. Good to see you. Thanks for coming in.
Thanks for having me.
So you and other ambulance providers across New York, it seems like you're trying to really join forces, right? Power in numbers here, and going to the state and saying, look, this has got to change. What is the sort of game plan as you're moving forward in this session?
Yeah, I think unfortunately it's awareness and education at this point. The question is how many of our elected officials are aware of the gap that exists between Medicaid coverage and cost to provide service, as well as the numbers you've already mentioned in terms of a shrinking workforce and fewer number of people who are willing to get involved in our business and serve the community, and something that really needs to be provided.
And there's the connection there, right? The reason that you have the shortage of workers in the industry is because you can't pay them as much as you would prefer, or that you probably need to because of the Medicaid reimbursement. And give us a sense of how much it costs for you to transport a Medicaid patient versus what you're actually getting for that service.
Yeah, so things don't break out perfectly in terms of the insurance paying for the service when you look at total costs, but costs to provide a transport are somewhere in the area of $650 to $700 around the state. Medicaid paying at its emergency rate is paying at about $250 right now, so
Whoa.
somewhere in the 40% range, a really significant gap.
And when a large portion of your patients are Medicaid patients, and that's how you're getting funded.
Right.
I mean, obviously, I've talked with ambulance owners and providers before. You have to make up that cost elsewhere, right, which puts a further strain on the system. How hopeful are you that the reimbursement changes this session?
Well, I'd have to tell you, hope isn't a strategy.
Yeah.
We know the conversation's happening. We know it's happening in more rooms and with more people than ever before. But I think the signals of whether it'll change the session were in the one House bill we saw last week, where the Senate did include $20 million in Medicaid, and we're grateful for that. Right now, we need about $67 million to close the Medicaid to Medicare gap, still paying less than it costs to provide service, but significantly more than it's paying now. So $20 million, we're appreciative of that discussion. It's a good start, but we hope to see a lot more in the very near future.
And just to let our viewers know, so the way this works, the Assembly comes up with a one House bill, the Senate comes up with one, and then they negotiate that with the governor and come up with a final budget that we believe is due April 1st, although it oftentimes misses that deadline. So we'll find out. I oftentimes, when we have these discussions, like to ask, why should the person on the other end of this camera right now care about this? And I think that the bottom line is it comes down to how good their 911 service will be when they have an emergency, right?
Right. So I can confidently say nobody wants to need an ambulance, but that everybody may need one, and when they need one, they want it right now. And the ability to provide service is absolutely connected to the ability to be compensated for the service provided. So for those who aren't using it, or for those who even are on Medicaid, recognizing that Medicaid is a critical component of paying for service and enabling the services to be available, we need to make this change so the service is available for all, and that we're not losing EMTs and paramedics and ambulance services as a result of underpayment.
Finally, what else are you doing to deal with that, the staffing challenges here? I mean, I think about like the shortage of nurses, right? The shortage of teachers. We seem to have shortages of so many of these crucial positions in our lives.
Yeah.
How are you addressing that?
So it's a labor shortage. It's not just EMS, it's not just healthcare, it's a labor shortage. The way that we're addressing it, and we've had a lot of success with recruiting, is creating our own in-house program where we pay people to be EMT students and become certified as EMTs, and then we have sponsorship programs with full tuition forgiveness if people want to progress to paramedic. And the whole time they are compensated as employees and function as employees of Twin City Ambulance, later becoming certified and functioning in a EMT or paramedic role in the field.
Well, we all know how important it is that an ambulance show up in your time of need. We appreciate you coming in. Bryan Brauner is CEO of Twin City Ambulance based in the North Town. It's great to see you. Thanks
for having me.
You bet.